guys, welcome back to Medical Coding with Blue. Today's episode is all about what to look for in your first medical coding job. If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, first things first. Your first job in medical coding will probably not be where you end up. It will probably not be your job for a long time, all right? In some instances, yes. Some people, they apply at one place, they stay there forever. But for the majority of us, the first place that we work as a medical coder is going to be our first stop, okay? Sometimes we have to go to different places. We have to try different settings in order to find our forever home. It took me 2 tries going to 2 different places, and then my third place was my forever home. So that was my journey into starting this. But I will say this, when you're starting out and you're looking for your first job, the first things first, you gotta take these 2 words off the table. When you see them, just take them off the table. Entry level. These are the 2 words that a lot of new medical coders look for. If you see a job listing for medical coding that says entry level, rest assured there's about 1,000 people applying for that job because they saw those magical words, entry level. When you get your medical coding certification, this says that you are competent to code anywhere. Now, employers will say, we want 3 to 5 years experience. Here's the thing. They say this because they don't want to have to train. That's number 1. Number 2, they also say it to scare off new people because a lot of people are going through these fast-paced medical coding programs that are less than 6 months. You know, these people out there, they're promising that you're going to be in a brand new career in less than 6 months, and these people don't have any idea about, these new people have no idea about medical terminology, barely know anatomy. They were just taught to pass a certification exam using tactics and techniques and strategies. And that's how they got their certification. So an employer who needs help and who needs somebody who's competent to code, needs somebody who really understands what they're doing. That's why they say, well, you know, if you don't have experience, blah, blah, blah. But here's the thing. You don't have to give up. You don't have to not apply because it is free to apply to jobs, right? That's number 1, right? Above all else, it is free to apply. They do not know you unless you avail yourself, you make yourself available, and you say, here I am. And how do you do that? How do you get an employer's attention as a brand new medical coder? You arm yourself with an excellent resume. And you do not copy the resume that is floating around out on the internet about medical coding because it is a very poorly written resume. It is shameful that people even call it a resume because, again, it's just very poorly written. I have a lot of videos on my channel about tips for resume tips for brand new medical coders. A lot of videos, guys. Check it out. I also do resume rewrites myself. My rate is in the description box below. If you're interested, you can contact me there. There are a ton of resume writers on LinkedIn as well if you are shopping around. But I will tell you guys this. When you are going to farm out your resume to somebody, make sure it is somebody who knows the industry, not just somebody who uses the same template for everybody and then that's it. And they call themselves a resume writer. Okay, don't do that, guys. Make sure it's somebody who knows and understands the language of our industry, of the health information industry. Because otherwise, you never know what you're going to be paying for. I'm just saying. So, with that said, you have to arm yourself with a very good resume. 1 page, max 2 pages. Don't be like these people I see on LinkedIn complaining that they can't find a job, and then when I look, they have a 3 to 5 page resume. Employers have very little time and very little patience to look at these resumes. If you do not grab their attention in the first 5 seconds of them looking at your resume and they're going to do a quick scan, oh, trust me, yours is going to go off into that reject pile really quickly. So make sure that you get to the point on that resume. 1 page, max 2 pages. Go back 10 to 15 years and that's it. If they need more than that, then they can ask you for it. But the resume is just meant to give a display of your immediate talents and your immediate strengths. So that you have to know. And please do not put organized on your skills list. Your skills list needs to be all of your hard skills, all the things that you were trained in, all right? Even though you don't have experience, you don't have to call attention to that, because your days of not being a medical coder are over, right? They are long gone. You are now a medical coder. You can't say I'm not a medical coder yet. The second you get your certification, you are a brand new medical coder, because again, you passing that certification means that you are competent. So you need to embrace that. Embrace your competence and get out there and apply. And arm yourself with a good resume, get out there and you apply for those positions that are asking for 3 to 5 years of experience. As long as the position is about medical coding, you still apply anyway. Now, when you are applying, you are going to look for places that's going to give you a wide range of experience. Places like the emergency department, where they would have you coding for procedures and evaluation and management, and of course your diagnosis coding, because that's going to give you a wide variety. There's many different specialties that get seen in the ER. So with that said, something like that is where you want to start off in. Start off in coding like a clinic, right? In a hospital, you can apply at a hospital. They have clinics in the hospital and they need coders for those clinics. So look to apply at those types of places. And when you are applying, look for reasonable expectations of productivity, because when you start applying for these positions and you have a really good resume and they're calling you in for an interview, ask them, what is your productivity standard? If they tell you something reasonable, meaning that they tell you that they're expecting the productivity to be between 80 and 150, right? Average per day. That is reasonable. If they tell you, oh, we expect our coders to code 320 per day, you can say, it was nice meeting you. Thank you for the opportunity to meet you, and then leave. Because 320 per day is not coding. That is data entry. That is a data entry position, okay? But keep in mind, if you act in the capacity as a medical coder and you're just pushing through encounters like that, you're not really taking the time to look at and comprehend what you're reading, you are responsible for the procedures that are being selected and the diagnoses that are being selected. If it is wrong, it's not anybody else's fault but the medical coder. That's why I'm telling you all, when you apply at places, make sure that the productivity standards are reasonable. If they are too high like that, 320, they are not looking for a medical coder. They are looking for a data entry person. That's what they're looking for. And you do not need that, because that is high pressure and it is unnecessary. There's plenty of places that you can apply. All right. So that would be my advice there. The other thing is, what does the workload look like? As far as, are you working from a work queue with a bunch of other people? And sometimes they will have you working from a patient list. So it's a list of all the patients that have been seen, and all of the coders will work from this same task queue. And then you just pick a record, and then somebody picks the next record, or they skip down a couple of records and then they pick one, and then it just goes like that, and everybody works from the same pile. The problem is with something like that, when you work from a task queue or a work queue, a situation where everybody's in the same thing, coders, the veteran coders, tend to skip. Even though they say, oh no, we don't skip here. Trust me, there's always some way to figure out how to skip. So don't get yourself caught up in that. Don't do that. Find a place where they're going to assign you a clinic. And maybe you're working with a partner. Okay, sometimes there's that kind of situation, and that is fine. But I will say, if you're working with partners, that you do have to be on the same page when it comes to the coding. Okay, because coders that work together in pairs and partners like that, they do need to show a united front with the providers if they're like in the clinic and things like that, meaning that both coders need to agree when they're speaking. Because if you go against your partner in front of the providers, now they're not going to know who to listen to. So even though you may disagree, or your partner may disagree with you, you need to sit there, smile, nod, support each other, and then later you can discuss what the error was, send out a email together to the providers to, submit a correction on what was said, and then, do it that way. You never, ever show in front of the providers that you disagree with your coworkers. Never. Because again, that's the thing. You have to protect the integrity of the house. And that's what I mean when I say is that if you're showing you a united front with your partner in coding, they're more likely to listen to you. And you want them to listen to you. Even if the advice from the other person or yourself may be wrong, right? You still need to show a united front, and then you can always go back and issue a correction later, but never disagree with your coworker in front of the providers. Okay, so that's just one thing. But if that's the best case scenario is that you have your own clinic or that you are working with a partner. Okay, that is the best case scenario. But again, if it is that you're working from a work queue, I would be like, I'm gonna go look for another another place. I would do that as a brand new coder. I would definitely say, okay, thank you for the interview, and then I would continue to look for other jobs. You don't have to stop the interview right then and there. You can continue on with the interview so that you can get that practice and you can start to feel comfortable doing interviews. Does anybody like to be interviewed? I mean, for like a job? No, it does make a lot of us very nervous. However, it is a fact of life. It is what we do. So the more practice you get with it, the easier it becomes. And the better the experience, right? Because ultimately, you are meeting your potential future boss. And so you may be there at that place for a while, and so get to know that person. And that's the whole purpose of having interviews. Okay, so like I said, when you're looking for jobs, this is what you want to keep in mind if you are a brand new medical coder. Okay, so that's my advice on that part anyway. But yes, you want a place that's going to give you lots of experience. On the show tonight, I was in the chat box, and somebody mentioned that in their area that every job in their area is remote. Some places in the US, I've been hearing it's like that. They don't have places for the coder to be embedded in the clinic or at the facility or whatever. To me, that's unfortunate because I think when the coders are housed away from the providers, that it leads to this sort of disconnection between the coder and the provider. And then not only that, the brand new coder does not have exposure to other coders. So here's my advice on this. If you have the opportunity to work someplace or work remotely, I strongly recommend to work at a place. However, if it is not possible because of your area, a lot of places on the East Coast are like this. Some places on the West Coast are like this, but I think it's more common on the East Coast that everybody works remotely as the coders. If it is possible, apply at a place that you have to physically go so that way you can get exposure to those coders. If it's not possible and everybody works remotely, then that's just where you are. Everybody works remotely. The only thing is you're going to be missing out by not having that one-to-one mentorship with other coders in person. Okay, so there's a little bit that you're missing out on. The folks that were brand new at the beginning of the pandemic and everybody, was going through all those things working remotely, they were able to get jobs working remotely as brand new medical coders. And some of them are still working remotely, have never been in a facility, have never been around other medical coders. So I do believe that their growth is a little bit stunted, because when you are not around other medical coders, you don't learn as much as when you are around other medical coders. You're able to see things a little bit differently, because somebody will say, well, it's this, and this, and they'll explain why. And it's a lot easier being in person, right? Than it is doing virtual or being, online and things like that. So that's just my advice anyway. I strongly recommend, I will always recommend to be in person. However, if it's that where the cards fall is that, you have to be online and virtual, then, just do that, just do remote. But I will say that working remotely, if you're brand new, this is not a picnic, all right? It's not a picnic. It's not a situation where you can, start working, get logged in, throw in a load of laundry, run the kids to school, and, make breakfast and do all these things. You have to be at the computer. You have to treat it like you are at the office. And sometimes the standards for working remotely are a little bit higher because you're working remotely, and you shouldn't have all the distractions like you would if you were in an actual facility, right? If you're in the facility, you've got people coming in and out all day long, and then you've got, breaks and all that other stuff. When you're at home, they're going to demand more of you. So that's just something that you have to know and be prepared for, right? So, but yes, if you're going to be working remotely, you just have to kind of learn very independently, and you have to really go with it. That's just what I'm going to say on that one. But yes, so that would be what I look for. Reasonable productivity standards, okay, between 80 and 150. Please do not comment that, oh, I can do 320, because that's not coding at that point. That's just data entry, all right? Anything higher than 150 is just pushing numbers through, and that's just not coding at all, okay? The other thing is your work situation, like the work queue. Is it in a work queue, or are you assigned particular clinics? It's very important to distinguish the difference, because if you're working in a work queue, you, as a brand new medical coder, will catch the brunt of people skipping. I know, because it happened to me when I worked remotely for a level 1 trauma hospital. Now, I've done same-day surgeries before. I have no problem working traumas. However, my problem is that, I'm working and I see nothing but like really long, very complex encounters, and come to find out the people were skipping. So while I got stronger as a medical coder because of it, because working in these challenging encounters, it was not right. So that's another thing I've got to say. Just watch the work queue situation, all right? Productivity, work queue, and then, like, again, where are you working? The other thing that you need to look out for is what are their expectations on accuracy? Accuracy is a huge thing. How often are they running audits? Is it that they're running them every quarter? Are they running them every month? That's something else that you have to ask them. Typically, when a brand new coder gets hired on, you will work in a pre-bill situation, which means they will give you like a set of 40 records, or they'll give you a set of 50 records. You have to code all of those 40 or all of the 50. And when I worked for Level 1 Trauma Hospital, it was 50. You had to code 50. They audit all of those, and then you have to get over a certain percentage. In my case, I think it was 95 I had to get over. I got 96. And so I was able to pass the first pre-bill, the first run. So once I passed that, then I was able to, just work in the queue like everybody else, and it was no big deal. And so that's something that, it depends on where you are. And then as you are working in these places, you're going to find that they have different rules because of like the insurance. And that was something that I was running into, because my facility and where the Level 1 Trauma Hospital, they had different rules about insurance and things. So that was where I was like, oh, okay, it was adding a modifier, or it was, selecting a different code like a HCPCS code versus a CPT code. So that was something that was different for me too. So, that's the thing. You have to ask them, when it comes to the training, and that pre-bill situation of going through a batch of records at a time, what is the accuracy for that? What is the standard accuracy for when you are in the clinic and you are coding regularly? There's going to be times when your accuracy may dip below what the average is supposed to be, right? Let's just say that the average accuracy is supposed to be 95%, but that month there was a lot of things going on and maybe you got 93%. You're not going to get fired after doing that for a month. Now, if you continue to show a steady decline, then they're going to say, okay, what's going on here? So that's something that you got to kind of watch out for. But for the most part, if you see yourself slip 1 month, it's okay. It's nothing to worry about. We all make mistakes, and it's just a matter of, maybe you got a new auditor, somebody who has a little bit more experience than the last person, and they caught a few more things. It's just a myriad of reasons that, it would fluctuate like that. But the important thing is to strive for accuracy. And so that would be what you want to make sure that you ask them, what is that? What does the accuracy look like? And what does the pre-bill situation look like? So, and if you are going to work in a place, then you can ask them, what does the environment look like if you have to go to the facility? Are you working in an office with a bunch of people, or do you have your own office? Are you sharing an office? That's something that you have to know and ask, because again, that's very important. When I started here at my forever home, I was in a trailer because they were remodeling our building. And I was in this trailer, and there was 20 women in there, and we were all in bullpens. Bullpens, if you don't know, those cubicles that you at work, right? That's basically what a bullpen is. And so that's what we were in, and so it would get loud. Sometimes the girls would be giggling, and some people just can't be quiet, so that's when you have to get your headphones. And I went through quite a few sets of headphones when I worked in those bullpens, and then when we finally got into our renovated building, I went through even more headphones until we moved into the big, beautiful new hospital. And then it was just me and my partner, and that was such a good change, because you get tired of all the noise after a while, especially when you're trying to concentrate, And so, but yeah, that's the things that you want to look out for. What is the environment like? What is the accuracy? What is the productivity? Productivity is so key, guys. And make sure that you ask that. There is no excuse, even though they say, oh, the electronic health record it's the one that selects all the codes. We're just basically verifying. You still need time to verify, because I guarantee you a lot of those codes could be updated. There's more specificity that could be found. And sometimes it's that the providers need education. Okay, so that's something that you want to look for in these jobs. You want to look for opportunities where you're going to have that wide range of, of experience that you're going to get right away. Don't be afraid of starting in something that you would feel like, oh my gosh, I'm so intimidated, like working in the ER, because it's all these specialties and these different things. The more experience that you can put onto your resume quickly, the better off that you'll be, because you won't be scared next time you see those things. It'll be second nature to you. Whereas somebody who is showing fear as a brand new medical coder is, maybe hesitating and only wants to do easy things, even though there's no such thing as easy thing in coding. But they insist on keeping themselves small, right? And keeping, oh, well, I'll just do risk adjustment because it's just diagnosis coding. And then come to find out, when they've been in it for a year and they try to leave because they get bored, and then they can't do CPT coding, and they've forgotten how to select codes in the HCPCS book because they've been doing only diagnosis coding. And then they see in the job listing that risk adjustment is not considered experience with some employers. They even say it in the job listing. If your only experience has been in risk adjustment, that does not count as experience. So that's why I say risk adjustment is meant to be a short-term thing. Get your experience, yes, but move on quickly. Don't stay there long, because I know a lot of you will stop studying and you won't study for evaluation and management, and you will definitely stop studying for the CPT procedural coding. So you still need to make sure that you maintain your knowledge on that if you're going to do risk adjustment for some time. Okay, that's just my advice anyway. So that's it. That's my show for tonight. If you are out there searching for your first job, make sure that you apply for everything. Okay, don't be looking for those words entry level, because trust me, everybody else is looking for those. Make sure that your resume looks good. Make sure that you stay positive, because you will find a job. Okay, you just have to keep looking. All right, so I'm gonna wrap this one up. Thank you guys so much for joining me. Have a great weekend. I will see y'all again on Monday. Please like, subscribe, and share, and I'll see y'all next time. Bye.